My name's Melanie McNerney. I'm the veterinarian who helps here at the shelter. I'm going to be doing physical exams, vaccines, and just routine wellness care.
And today we have a bunch of babies getting their first vaccine. First, we'll start with Mom. She volunteered.
So we just do a quick physical exam, looking in the ears, looking at her mouth and her gums, feeling her lymph nodes. So she sounds good. Mom is thin, but she's nursing 7 babies, so I expect that. She's using a lot of calories to make milk. Just feeling her belly, the rest of her lymph nodes. So she looks good, other than being thin, but she'll gain weight when she's not nursing so many babies anymore. So Mom's going to get 2 vaccines today. She's going to have her rabies vaccine, which is once a year. And then she's going to get a distemper vaccine.
So these guys, I believe, were part of a surrender. Mom was surrendered with a male. Why we knew to suspect that she was pregnant, and it turns out she was. So she went into foster care once we knew that she was. And this is her first time back since having her kids.
So we're also today going to find out the genders of all the babies. And she's got 7 babies. And take pictures of them for their record. This one is a little boy. So he's going to get the first distemper vaccine, and then they'll get booster vaccines every 3 to 4 weeks until they're between 4 and 5 months old. So the medication they're getting for parasites, they're also going to get a booster of that every 2 weeks for about 3 doses.
So this is Andy. Andy was surrendered with another cat. So I think it was 2 brothers together. Both orange, handsome lads.
I'm going to guess that he is not neutered because he's got these really big fat cheeks, which they'll develop when they're not neutered. So when they're outside, the males are pretty territorial. They're going to fight over females. And I think that's just a little bit more protection if they're getting attacked on the face. They've got extra, and he's not neutered. You a talker?
Yeah. I am pretty sure she's in heat because she keeps raising this butt up.
Looks like she is, yeah. Hi.
One of the big telltale signs to see if a cat is in heat is if they kind of act it and they'll raise their butt.
So when I'm looking at her teeth and her mouth, trying to guess how old she is by how clean her teeth are, if she has missing or broken teeth, if she has really severe dental disease. Her teeth look really good. They're nice and clean. I suspect she's another young cat, just a few years.
I did notice she has like a little bit of a break
she's
in
got
her
an
heel on her.
old break in her tail.
Just so that we have.
So we're going to shave her abdomen to see if there's an obvious space scar. I also suspect she's in heat, so I'd be surprised if she was spayed. Yeah, so her abdomen looks pristine. I don't see any scars.
So here I have Andy's brother. This is Ollie.
Hi.
He came in with some green fluid coming out of his eyes at first, so.
Oh, yeah. So he has what's called entropion, which is where his eyelids roll inwards. So the hair on the fur on his eyelid is contacting his eye. And there's 2 types of entropion. There's one that happens, it's called spastic entropion, and it's because they're really painful. So if they have a wound on their eye or an infection in their eye, they'll actually roll their eyelids in. And then you can also have one that's just an abnormal conformation to the eyelid, and that needs to be repaired surgically. So I suspect he's going to need surgery. His looks very severe. And it's painful for them to have the fur touching their eye. So he's got his 3rd eyelid, which is that pink membrane on the inside of his eye, pulled up to try and protect his eye. And the fur rubbing on the eye can cause ulcers and abrasions on the cornea, which is the outer surface of the eye. We'll start him on triple antibiotic right now. It's a handsome boy. So it's not very common to see entropion in cats. I think in the years that I've been at the shelter, this is the second or third cat that we've had.
The one, the only Peanut. She also had a bit of conjunctivitis that we've been treating. So we're just, again, rechecking her, making sure she's all good.
Yeah, I think her eyes look really good. So she's obviously very overweight. She's getting weighed once a week. She's on reduced calorie food and also smaller portions. We're trying to track and hopefully see that she's losing weight each week.
Okay.
17.3, 4.
Which is better because she was 17.8 last time we weighed her.
Yeah, so she's going in the right direction. So we start out with cats. We'll go through all of the new cats that have come to the shelter, do physical exams on them, give vaccines. Then we'll go to the cats that are sick or having any health concerns. I'll see if they need to have any treatments or monitoring. Then we'll work through the exotic pets. So they've gotten a lot of bunnies in this week, I saw. They'll look at anything they have here. They've had birds and chickens. They've even had some turtles come in. Then we'll go through the dogs, and it's the same thing, wellness and health. So similar exam, looking in their ears. Rabbits can also get ear mites. I can't do a full oral exam on a rabbit, but I'll look at his incisors, listen to his heart and lungs, palpate his abdomen. I'm looking to see if he has discharge from his eyes or his nose.
You can also notice I'm handling the rabbits in a very different way than I was handling the cats. That's because rabbits can actually kick so hard that they can hurt their backs. So I need to hold them in a certain way to make sure that they don't hurt themselves.
It's Tempe. She's a bulldog mix of some sort. She's getting rechecked for her skin. You can see she's got some little bald spots here. It looks much better than it did. Her skin's a little red and flaky. Bulldogs are very prone to allergies, but the fur is already starting to regrow. She's just got a lot of dandruff now. So we started her on an antibiotic for her skin. We also did a treatment in case she has mites.
She is also on poultry-free food because poultry tends to be a common allergy that they all have. Oh, little girl. Oh, little girl.
Benefit of the doubt.
Dog spay check.
So she has something. I don't know if you can zoom in. This is an umbilical hernia. So this little lump here is where her belly button is, and it's a defect in her abdominal muscles in the wall. So there's some fat or something from her abdomen that's kind of spilling out. So that'll get fixed when she's spayed. She's not spayed right now. So who's this?
This is Buffalo.
On his,
I was not here
on his
for it.
face.
Yeah, his lip.
Oh, yeah, he's
apparently.
got like a little wound. Yeah, it looks like it's healing well.
Good. He just, he's not on anything. Should we put him on like a cephalexin or something?
I would put him on an antibiotic. Yeah. This was through the kennel, I'm assuming, or was his mouth?
Yeah, through the kennel.
Ooh. He's still eating and drinking. No problems with that since that. Okay.
He actually.
So the dog that I had just examined has a bite wound on his lip from another dog in the kennel. So we're going to do an antibiotic. They have a lot of bacteria in their mouths. I don't want it to get infected.
So if we notice anything here as shelter staff, we'll always bring it to the vet's attention, no matter how long the animal's been here, just to make sure that everybody's happy and healthy to the best of our abilities and kind of all that entails. Try to do right by every dog and do what we can for everybody.
So you said stiff in his hind end that you're noticing?
Yeah, his back legs are getting stiff.
Okay. Ooh. I'm going to spin him and I'll have you, hold near his head. Does he limp at all, or he just looks stiff and odd when he's walking?
He just looks a little stiff and odd as he's walking. He doesn't really favor one leg or the other.
So he definitely does not like his legs being extended, which would be hip discomfort.
And I'm pretty sure I've noticed that gets slightly bigger.
Okay, and she had written that he had one near his scrotum or prepuce as well. You gotta bend a little bit for me. No, this side he doesn't care, but he really didn't want me to extend to that hip.
Okay, so maybe it's just that side.
And he was outside, right? He was one of, like, so he's pretty active.
Yeah, he's pretty active.
Yeah, he does have a little growth there too.
He's a good boy. He loves his walks.
So he's uncomfortable when I'm trying to extend his right hip. There's a lot of reasons for that. He could have a soft tissue injury, like a muscle pull or a strain. He's pretty active and he was out in a pen today. Could be arthritis or an old injury. So we're going to start him on a supplement that's for joint health and also a pain medication and then recheck. So these papers are basically health certificates. So very similar to what I type in the computer, I just write any abnormal physical exam findings on here. And then it's me signing off that they're healthy to be adopted. Yep, and if they're not healthy enough, if we're doing treatments for something, they don't get a health certificate yet. And then once they're cleared, we'll do the health certificate.